Welcome to Ask Dr. Geier Live, wherever you're watching. Hope you're making today your masterpiece. I am Dr. David Geier, triple board certified orthopedic surgeon, sports medicine specialist, and anti-aging and regenerative medicine expert. I help you feel, look, and perform your best regardless of age or injury. I'm very excited to be here Friday, 12 p.m. Eastern Time, here on the East Coast, Charleston, South Carolina. Hope wherever you are, hope you're preparing for a fantastic weekend. Please remember, this is the one place, the one time that I do answer medical questions: injury, surgery, rehab, recovery, health, wellness. At least I'll do my best. If it's a topic I know, and if it's orthopedics, I'm sure I'm going to know it, but I am happy to talk about it. Just remember, I cannot give you specific medical advice on this show, in anywhere online or in social media, because I'm not your doctor, you're not my patient. I haven't seen you and examined you and looked at x-rays, MRIs, that kind of thing. I can't give you specific medical advice. These answers are meant for general information and education, so that hopefully then you can go see your doctor and understand a little bit better what he or she is talking about. Or you basically see the doctor first, get a bunch of information that you may or may not understand, and I'll try to translate it to English, but I am not giving you medical advice. Also, if you're new to this show, or even if you're not, please know, if you want to ask a question, put it in the chat, not in the comments. I cannot see the comments. It's funny, when I go back after these shows and look at the comments, there's people that are like, why aren't you answering my questions? Because I can't see it. I can only see what's in the chat. I'm not actually in YouTube right now. I am on a service called Restream that sends it out to YouTube and brings the chat back in. So that's why I can't do that. For what that's worth. Georgia, is good as always to see you. I don't know why that's so small. Let's try to make that a little bit bigger. But always good to see you. And we'll start with George's question. Causes and treatments for trochanteric or trochanteric. So that's a little different than what we call it here. Usually, I think what she's meaning is what we call trochanteric bursitis. Trochanteritis would be an inflammation of that greater trochanter. Let me see. All right, so I've got a hip model, but it doesn't exactly have what the irritation is. This is the greater trochanter of the hip, of the femur, but part of the hip joint, bony prominence on the side of your hip. There is a tendinous structure that runs all the way down the side of your leg. Down lower in your leg, it's called the iliotibial band or IT band, but up here, it's called the tensor fasciae lata. But that runs right over that bony prominence. And to prevent friction, because as you're basically moving, walking, that tendon is sliding back and forth, there's a bursa, a fluid-filled sac between that tendon and the bone there, and that is called the trochanteric bursa. Now that can get inflamed by repetitive motion and that friction. Sometimes that is sort of how it starts, but then it actually gets a small area of degeneration within, they're not shown here either, but there's a number of different muscles and tendons that attach to that bone as well, the small little abductors and external rotators of the hip. And if for long-standing trochanteric bursitis, if you get an MRI, sometimes you see that, and that's become a more recognized source of pain, where sometimes you would need something like platelet-rich plasma to try to get that to heal, or even sometimes surgery. But fortunately, in the short term, that is the trochanteric bursitis is something that can be treated with stretching and physical therapy. I feel like that's the most reliable. Cortisone can be helpful, but my concern about cortisone, certainly more than once, is that yes, you might feel better for a little while, but a lot of times it comes back and it can weaken those abductor and external rotator tendons and potentially lead it to being a more long-standing problem. Once, maybe that's not such a big deal, but I certainly would have some reservations about doing that multiple times. But the vast, vast majority of people, that is enough. Now, if for whatever reason injections aren't working, stretching, physical therapy aren't working, you typically think of some kind of surgical treatment. I like to get an MRI before that surgery to find out, hey, is this the bursa, and can I go in and just take out the bursa? Or is there a tear of one of those tendons that potentially would need to be cleaned up and reattached? So, a complicated answer, but fortunately it doesn't get to that all that often. Syed, I appreciate that. Videos help a lot. I am always grateful. I just recorded another batch of videos that will go up really soon. So very excited to hear that. All right, Luke, what does it mean when you hear a pop in your knee? That's a little tricky because popping can be any number of things. A lot of people have, where's my knee model? Normal, what we call crepitus of the knee, whereas the knee goes through a range of motion. You get basically rubbing between the articular cartilage of the patella and the front of the thigh bone of the femur, and that just causes popping. But if you go in there and scope the knee, you don't find anything. If you want evidence of that, just go find teenage girl soccer players, put your hand on their kneecap and have them go back and forth, flexing and extending their knee, and about a third of them will have that sort of a crepitus sensation, or a quarter of them, but it's pretty common without any structural damage. And as you start to develop arthritis in that area especially, you can definitely get popping. But it could also be a sign of just abnormal tracking of the kneecap or just mechanics, but it could be something more worrisome like a meniscus tear or something like that. It's really hard to tell. Just based on that, I don't get terrible, and most orthopedic surgeons don't get terribly worked up about popping unless it's significantly painful, and then might go find a cause for it. He also asks, bilateral knee pain just means both knees? Luke, best treatments for knee pain that can help with the pain. Again, that really is tricky because it depends on what the source of the pain is. There's not any one answer for all types of knee pain. That could be physical therapy. That treats a lot of different causes of knee pain, like patellofemoral pain, iliotibial band syndrome. It can be something like injections, depending on what the source, like arthritis, albeit injections a lot of times, especially if it's steroids or viscosupplementation, hyaluronic acid, don't cure the arthritis but might relieve the pain. Something that might, stem cells, PRP, exosomes, which are experimental. In theory, there might be a hope that regenerates cartilage. And then surgery sometimes, ACL reconstructions, meniscus tears, things like that. Georgia says, thank you. You're so welcome. I hope that was helpful. Kind of a long answer to the trochanteric bursitis. Mary, grinding in my shoulder now, limited motion, lift my arm, pain happens, been 2 months. It's hard to know, and it depends, again, and I always say, I hate to give these answers where it depends, but it really does depend on why the motion is limited. Generally, the motion getting limited can happen after a traumatic event, and the problem that happens once the shoulder gets stiff and that capsule around the ball and socket starts to get tight, then trying to push to the edges of that range of motion gets even more painful, and then it gets tighter and it's this downward spiral. So if you can get to that early, physical therapy to improve the range of motion can be very helpful. Once it gets like a full-blown frozen shoulder, adhesive capsulitis, then a lot of times you're talking about a procedure, either a manipulation under anesthesia where the surgeon goes with you sort of asleep, goes in and sort of breaks up the capsule a little bit to allow more range of motion, and then you do a lot of physical therapy to preserve the range of motion, or a surgery where the surgeon goes in and cuts the capsule, releases that tight capsule, and then again you do a lot of physical therapy after that to preserve motion. Luke, you're so welcome. I am very helpful, or very happy that it's helpful. And Mary says she's going to see the doctor in a couple of weeks. Yeah, keep us informed. Come back after that visit and let us know. All right, that'll be it for today. Thank you so much for watching. If you catch this after the fact and wish that you had made it, know that we do these once a month on Fridays, usually the last Friday of the month, 12 p.m. Eastern time consistently. We've toyed around the idea, my team and I have toyed around with moving the day and time of day to potentially allow people to watch it a little bit easier. So that's something that we have talked about, but most people seem to like Friday at 12 p.m. Eastern time. Georgia, you enjoy your weekend too. Everybody out there, enjoy your weekend wherever you are, whether it's Greece or any other country in the world, whether you're in the United States. I hope you have an amazing weekend, and I look forward to seeing you very soon. Take care.